My name is Brittany, and I'm an occupational therapist at Inpatient Rehab. An occupational therapist does a lot of things. Specifically, in my setting, occupational therapists help people who have suffered some sort of injury or have had a stroke or brain injury, or they've lost the ability to be independent. My brother has Down syndrome, and watching him get his occupational therapy, seeing him enjoy that is what kind of got me interested in what occupational therapy was all about. We wear scrubs to work, specifically black and red ones. The different professionals wear different scrubs to distinguish themselves from other professionals. Somewhat recently, I had a patient that really stood out to me. She had had a stroke, and she was not aware of things on the left side of the room specifically. Like if she was coloring a picture, she would only color things on the right side of the picture. And I was having her work on washing a plate. Even though her one arm wasn't working, I was helping it work because there's research that says that that's a really effective method. And I'd seen some traces of movement, but she couldn't do it if I asked her to. So I was helping her wash the plate, and next thing you knew, she could move that arm. It wasn't like she was reaching up and giving me a high five, but she was able to start moving that arm. And a week later, she was able to actually start using it for functional activities, and we all pretty much started crying on the spot. Once I had a patient who, he had been a very difficult patient, difficult more emotionally. He was a younger guy, had gotten in a car wreck, fell asleep while driving, and he didn't listen to any of the recommendations that we gave him most of the time, and he was the first patient that actually tested me emotionally enough that made me cry. He didn't see it, but he was very challenging because he made you feel incompetent in a lot of ways, in the ways that he responded. We really kept working with him. I kept trying to motivate him, let him know, if you don't do this, you're not going to get better. We need to get you stronger. We need to get you home. 2 months later, I got a phone call, and he goes, "Hey, it's me. I just wanted to let you know that I'm sorry for how I acted when I was in rehab, and now I see that you guys were just trying to help me." And it was really cool. I told him it's already been forgiven. This is not your normal setting, and it's hard to trust people when you come into these kinds of situations. It was a really cool experience to get to talk to him again. In the hospital, we have a lot of different things that we use to help patients get better. We use functional activities. I get people in the kitchen and we cook. We stand up and we practice folding laundry. We practice reaching down and putting dishes away in the dishwasher, and reaching up and putting dishes away up in the sink. Documentation-wise, we tend to use the computers. We also use the Wii at work. We'll use that to work on balance and strength and things like that. The hardest part of my job is when I do my job right, when I am doing all I can do as a therapist to help someone out, and either they aren't trying. Also, another thing that's very difficult about my job is sometimes you'll work with someone for weeks, somebody who's really started out in a really bad place, and you get them so much better, and all they need is to be able to live with somebody and somebody to supervise them, but they have no family support and they have to go to a nursing home. That is the hardest thing to watch. My advice to someone who is interested in occupational therapy: get exposed to what it's like to be in the medical field so that you're not afraid of things like poop and wires, and what can you unplug from the wall when somebody's connected to things. Get involved in as many different types of things as possible, because you need to be able to relate to the people that you're trying to help get back to life, and you need to know what life looks like when it's very different than your own. It's important that you can talk to very different cultures, religions, interests, in order to be a truly effective therapist. I do speak Spanish. I'm not perfect. My most common phrase is "hablo más de yo comprendo." I speak more than I understand. I feel bad when I wish that my caseload would have more Spanish, because I'm not wishing that people that speak Spanish would have strokes. But if they are going to have strokes, I want them to come to me, and I want to be the one to help them get better.